now we also have joining us is Mr. AmitaBh Kant. He's the G20 Sherpa, also former CEO of NITI Aayog. Thank you so much, Mr. Kant, for joining us today. I think what we would all like to know, what we would like to know here is about, if you can tell us, India's G20 Sherpa, how did India's presidency in 2023 focus on global health issues? And can you also tell us what were the key outcomes?
So India's G20, both health and nutrition and sustainable development goals were very critical issues. India achieved a consensus across all countries, G7, emerging markets, as well as Russia and China all came together. But one of the key issues was on sustainable development goals, because vast segments of population had gone below poverty line due to COVID. And health and nutrition had been badly impacted. But one thing which came out very clearly was that two things make a difference. One is nudging behavioral change amongst young people. That is, how do you use the nudging theory to make people aware of cleaning their hands, which is very important. And the second thing was that climate will have a huge impact on health in the coming years. And therefore, the dimension of both climate and health has to be studied very closely and action has to be taken. And both these require two things. One is community action in a very big way. Unless and until we are not able to make community a part of this movement, it will be very difficult. And secondly, wherever success has been achieved, the government has worked with the people of the locality and the society, and therefore good governance and municipal reforms as far as garbage collection is concerned is very critical. We've seen success in Indore, we've seen success in Surat, we've seen success in Mysore, Bhubaneswar, many of these cities. But this movement needs to be carried across all Indian cities and all Tier 2, Tier 3 cities, so that the vast segment of the population which gets impacted due to impact of garbage, that much like what we've done in toilets, much like we've created over 120 million toilets in the Swachh Bharat mission, the next phase has to be about cleaning up of our cities in a very big way.
Mr. Kant, my question to you is, this is Ayushman, my question to you is, how can we encourage more collaboration between Indian innovators, global health organizations and government bodies to develop and implement effective health solutions?
So that's a very critical question, because a lot of innovation has been done, like the twin toilet in India. We've seen huge innovation in places like Tamil Nadu, in Kerala, where community has become a part of this movement. I mean, beaches in Kovalam, for instance, were cleaned up by the community. And similarly, much of the movement in Indore became community-centric. That is, people did not allow others to litter. I think what we have to do in the next course is work with international community. There are a lot of global best practices in different parts of the world. We have to adapt them to India. And I think there are many United Nations organizations who are willing to collaborate with us. The Bill and Melinda Gates Foundation has collaborated with us to do a lot of innovation in many of these areas of both sanitation, garbage collection, municipal waste. The challenge is really to ensure that our waste gets converted into wealth. And that wealth has a huge economic dimension. It can be the biggest job creator for us. And while we are creating waste, it will also have a multiplier impact on the air quality in many of our cities. So all these are very critical issues, and this linkage between community, the people, innovation, and global organizations has a very huge multiplier impact. And I think many of our civil society organizations are working towards this.